My name is Aric Rankin, and I'm a nurse practitioner in primary health care at the Aboriginal Health Centre in Brantford, Ontario. So I've initially, during high school, I wanted to be an architect, and I was pretty passionate about that, taking all the classes, and I became quite ill. I was hospitalized for about 3 months, and it was during that time that I received amazing care from a couple nurses in particular, but really all of the nursing staff. And it was at that point in time that I realized that's where my passion was, and that's exactly what I wanted to do. So I applied into the nursing program and was accepted, and ever since then I would say it was one of the best decisions I've made, was to get into the profession of nursing. The first thing that's obvious that it's unique is that I work at the Aboriginal Health Centre. This is a centre where, if you compare it to another community health centre, we care for the Aboriginal population. So there's that dynamic of traditional healing and traditional medicines and the culture and history that go along with that. We here at the Aboriginal Health Centre really try to focus on not just Western therapies, but also traditional medicines and treatments. So I'll often talk with the traditional healing group to see how we can work together. And we'll work together to see what other supports, whether in the community clinic here or perhaps in the community itself. Maybe it's a sweat lodge, maybe it's a smudging ceremony, all those types of different things that are culturally important to the families and individuals. Being able to care for not just the individual patient, but to care for the entire family really is one of the reasons why I moved from acute care emergency to doing family medicine, doing primary health care, so that I can really take care of the whole community. Every day I would say is an interesting day. I usually know what's coming in through the door, but at the same time I don't know, because oftentimes there are quite a few people that come in and require services, and I usually try to accommodate that. There are some days when it's, there's so many issues that are not the client's fault. They're just those barriers and those struggles that unfortunately the Aboriginal community faces day to day. And on those days it's really tough, because you can't always do it all, and it's utilizing those community resources to really strengthen the ability for clients to get that health and wellness that they need. I have that unique experience to be working with this community that is marginalized and that does face a lot of barriers. So whenever that opportunity presents itself, of course I'm going to speak out, because I'm seeing those patients on a day-to-day basis and working with them to be able to solve those problems so that they can achieve health and wellness. You have to have that need and that ambition to constantly want to learn. There isn't a day that I come into the office and not look something up. I'm always taking a look at what the research is and what the new evidence is for any medical condition. Another thing that I think a nurse practitioner, it's important to have is the ability to work as a team. That kind of team player mentality is so important, because I'm often working with our registered nurse, I'm working with our physicians, I'm working with the reception staff at the front desk to really make sure that things go in the favor for the client. Using the knowledge and skills and expertise as a registered nurse, and then expanding that scope to be able to diagnose and prescribe and order laboratory or diagnostic tests, working and collaborating, whether it's consulting another physician, is really remarkable. And I truly believe that the nursing philosophy and our nursing experience really plays a huge role in those expanded scopes of practice. So I would encourage all nursing students to consider the role of the nurse practitioner.